Hello and welcome. Today we're going to discuss something incredibly important for your health, a topic that often goes overlooked until it's too late. We're talking about stomach cancer. The reason this conversation is so vital is that stomach cancer is notoriously sneaky. In its early stages, when it's most treatable, its symptoms are often vague and can be easily dismissed as everyday problems like an upset stomach or indigestion. But what if those quiet whispers from your body are actually early warning signs? Knowing these signs, understanding them, and taking them seriously can be the difference between an early diagnosis and a difficult fight. Our goal today is not to cause fear, but to empower you with knowledge. Because being aware of these 8 potential early signs of stomach cancer could, quite literally, save your life. First, what exactly is stomach cancer? Before we dive into the signs, let's quickly understand what we're talking about. Stomach cancer, also known as gastric cancer, begins when healthy cells in the lining of the stomach change and grow out of control, forming a tumor. This process doesn't happen overnight. It can develop slowly over many years. Because the early signs are so similar to less serious conditions, many people unfortunately ignore them. This is why it's crucial to listen to your body and understand what it might be trying to tell you. So, let's get into the 8 early signs you need to be aware of. Sign 1. Persistent indigestion and heartburn. This is perhaps the most common and most easily dismissed symptom. We've all had indigestion or heartburn after a spicy or heavy meal. You feel that burning sensation in your chest, maybe some burping, and you reach for an antacid. But here's the key difference. We're talking about persistent indigestion. This isn't something that happens once in a while. This is discomfort, burning, or pain that just doesn't go away or keeps coming back for 3 weeks or more. It's a chronic feeling of discomfort in your upper abdomen that over-the-counter medications don't seem to fix like they used to. Why does this happen? As a tumor grows, it can disrupt the normal digestive process. It can irritate the stomach lining and interfere with the way stomach acid is managed, leading to feelings of heartburn or acid reflux. So the takeaway is this. If your indigestion has become a constant unwelcome guest, it's a signal to get it checked out. Sign 2. Feeling full after a small meal. Have you ever sat down for a meal feeling hungry, but after just a few bites you suddenly feel incredibly full? This feeling is known medically as early satiety, and it's a significant red flag. You might find you can't finish meals you once enjoyed, or you feel uncomfortably stuffed after eating much less food than usual. This isn't the same as just having a smaller appetite. It's a distinct physical sensation of being full too quickly. Why does this happen? As a tumor grows, it can take up space in the stomach, reducing its capacity to hold food. It can also make the stomach wall more rigid and less able to expand when you eat. This sends a signal to your brain that you're full even when you've barely eaten. So if you consistently feel full after just a few bites of food, don't just write it off as a shrinking appetite. It's a crucial sign to discuss with your doctor.
Sign 3. Nagging abdominal pain or vague discomfort. Stomach aches are common, but the pain associated with early stomach cancer is often described differently. It's typically a vague, nagging pain or discomfort usually felt in the upper abdomen above the belly button. It might not be a sharp, severe pain, but more of a dull, persistent ache that you can't quite pinpoint. It's the kind of discomfort that's just there. It doesn't seem to be related to hunger or specific foods, and it lingers day after day. Why does this happen? The tumor itself can cause inflammation and irritation of the stomach lining, leading to this persistent pain. As it grows, it can press on surrounding tissues, adding to the discomfort. While many things can cause stomach pain, from gastritis to ulcers, pain that is constant and doesn't resolve should never be ignored. Sign 5. Unexplained and unintentional weight loss. This is one of the most serious warning signs for many types of cancer, including stomach cancer. We're not talking about losing a few pounds after starting a new diet or exercise routine. We're talking about a noticeable drop in your weight when you're not trying to lose any. Losing 5% or more of your body weight over a period of 6 to 12 months without a clear reason is considered a medical red flag. For example, for a 200-pound person, that would be a loss of 10 pounds or more. Why does this happen? This weight loss can be a result of several factors combined. The feeling of early satiety we mentioned means you're eating less. Nausea might reduce your appetite. But more than that, cancer cells consume a lot of the body's energy and can release substances that change the way your body processes food into energy, leading to muscle and fat loss. If your clothes are getting looser and the number on the scale is dropping without any effort on your part, it is essential to seek a medical evaluation. Sign 5. Persistent nausea and occasional vomiting. Feeling nauseous from time to time is normal, but if you're experiencing a constant low-grade feeling of sickness, or if you find yourself vomiting for no apparent reason, your body is sending a strong signal. In the context of stomach cancer, the nausea might be mild but persistent. The vomiting may or may not be forceful. In some more advanced cases, the vomit may even be streaked with blood or look like coffee grounds, which is a sign of digested blood and requires immediate medical attention. Why does this happen? A tumor can create a partial blockage in the stomach, preventing food from passing through smoothly. This backup can lead to feelings of nausea and the body's reflex to vomit to relieve the pressure. If nausea and vomiting have become part of your daily life for more than a few days, it's time to see a doctor. Sign 6. Difficulty swallowing. This symptom, known as dysphagia, feels like food is getting stuck in your throat or chest as you try to swallow. You might have to chew your food more thoroughly or drink liquids to help it go down. This sign often occurs when the cancer is located in the upper part of the stomach, near the esophagus, the tube that connects your throat to your stomach. Difficulty swallowing is never a normal symptom. If you experience this, it warrants an immediate visit to your healthcare provider for investigation.
Sign 7. Frequent bloating, burping, and trapped gas. Feeling bloated or gassy after a big meal is one thing, but feeling constantly bloated, as if you have a balloon in your stomach, along with frequent burping and a sense of trapped wind, is another. This isn't just about feeling a little puffy. It's a persistent feeling of pressure and fullness in your abdomen that doesn't seem to be relieved by anything. Why does this happen? Similar to other symptoms, a tumor can interfere with the normal movement and digestion of food. This can lead to a buildup of gas in the digestive tract, causing the uncomfortable sensations of bloating and pressure. If you're constantly feeling bloated and gassy for several weeks and it's a new pattern for you, it's worth discussing with a medical professional. Sign 8. Black stools or anemia-related fatigue. This final sign is actually two related symptoms. A tumor in the stomach can bleed slowly over time. This blood isn't always visible as bright red blood in your vomit. More often, it passes through your digestive system. As it's digested, it turns the stool a black, tarry color. Because this bleeding can be slow and chronic, you might not even notice the change in your stool color. But this gradual blood loss can lead to anemia, which is a low red blood cell count. The primary symptom of anemia is profound fatigue and weakness. It's a tiredness that doesn't go away with rest. You might feel breathless after minimal effort, look pale, or feel dizzy. Why does this happen? The tumor damages blood vessels in the stomach lining, causing them to bleed. The resulting anemia starves your body of the oxygen carried by red blood cells, leading to extreme fatigue. If you notice black, tarry stools, or if you're experiencing a level of exhaustion you just can't shake, it's crucial to get your blood levels checked by a doctor. Who is at risk, and what can you do? Now that we know the signs, it's also helpful to know the risk factors. These include being over the age of 55, being male, a long-term infection with a bacteria called Helicobacter pylori, or H. pylori, which is a major cause of stomach ulcers and gastritis,
A diet high in salty, smoked, or pickled foods and low in fruits and vegetables, smoking and excessive alcohol consumption, a family history of stomach cancer. If you have several of these risk factors and are experiencing any of the signs we've discussed, it's even more important to be proactive. Your action plan? Don't panic, but don't wait. So, what should you do if one or more of these signs sound familiar? First, don't panic. Each of these symptoms on its own is most often caused by something much less serious than cancer. However, and this is the most important message of all, do not ignore them. Don't wait for them to get worse. Make an appointment with your doctor. To help your doctor, you can keep a simple symptom diary for a week or two. Write down what you're feeling, when it happens, how often, and what, if anything, makes it better or worse. Your doctor will listen to your concerns and may recommend tests such as an endoscopy, where a thin tube with a camera is used to look inside your stomach. This is the best way to find out what's really going on. Conclusion: listen to your body. Your body is incredibly intelligent. It often sends quiet signals long before it screams for help. The challenge with early-stage stomach cancer is that its signals are whispers, a bit of indigestion, feeling a little too full, a vague ache. It's so easy to tell ourselves, it's nothing, it'll go away. But today, you've learned to recognize those whispers. By paying attention to persistent changes in your digestion and overall well-being, you can take control of your health. Early detection is the single most powerful tool we have against stomach cancer. Disclaimer: please remember the information in this video is for educational purposes only and should not be a substitute for professional medical advice. If you have any health concerns, please consult with a qualified healthcare provider. Thank you for taking the time to learn and to listen. Be well, stay informed, and never be afraid to advocate for your own health.